Breech and transverse births, risks and complications.
Hello everyone. Today we're going to discuss a critical topic that many expecting parents have questions about: the potential complications and risks associated with a baby being in a breech or transverse longitudinal position.
What are breech and transverse longitudinal positions?
First off, let's understand what we mean by breech and transverse positions. A baby is said to be in a breech position when they are positioned head up in the woman's uterus and are expected to come out buttocks or feet first. On the other hand, a baby is in the transverse lie or longitudinal position when they are positioned sideways in the uterus.
What are the risks of a breech position?
When a baby is in a breech position, there are several potential risks. 1. Cord prolapse. This is when the umbilical cord slips into the vagina before the baby does. This can cut off the baby's blood supply, leading to serious complications. 2. Birth injuries. Breech babies are at a higher risk of birth injuries, particularly to their head and spine. These could be caused by the force used during the delivery or because the baby's body comes out before the larger head. 3. Oxygen deprivation. This can happen if the baby's head becomes trapped in the birth canal. 4. Cesarean section. Breech position significantly increases the chance of requiring a cesarean section, which carries its own risks such as infection or complications from anesthesia.
What are the risks of a transverse position?
Transverse lie, or transverse position, is considered to be one of the riskiest fetal positions for birth and often requires a cesarean section. The complications may include: 1. Labor obstruction. The baby may block the birth canal, making vaginal delivery impossible. 2. Umbilical cord prolapse. Similar to the breech position, the umbilical cord might come out before the baby, which can be dangerous. 3. Uterine rupture. This is a very rare complication where the uterus tears along the scar line from a prior C-section. This is an emergency situation that can endanger both the mother and the baby. While it might sound worrying, it's important to remember that healthcare professionals are trained to handle these situations. If your baby is in a breech or transverse position, your healthcare team will discuss the options with you, and together, you can decide on the best course of action. Remember, every pregnancy is unique. The most important thing is to have open communication with your healthcare provider. Always ask questions if you're unsure about anything, and trust in their expertise to guide you through the process. And that's it for today's topic. We hope this has been informative and helped alleviate some of your concerns. Until next time, take care.